Welcome to Acting in Focus. I'm Vivian Kopsinger-Birchall, your host, and my special guest is Penelope Funaiole, who is the health director, and the title might be different, for the town of Acton. Penelope, welcome to the show.
Thank you so much.
Let's actually start with your title. I know that there is a merge between the health department and other divisions.
Yeah.
Tell us, who are you, what do you do for the town, and what is your title?
Sure. Yeah. I'll start with the department. The health department was moved into Health and Human Services department. So that includes the Council on Aging, nursing, our community resources, and our veteran services. The title is Director of Health and Family Services. So the idea being that that the nursing department, the community resource department, and the public health department are all really moving towards the public health field as it stands right now in Massachusetts. Most cities and towns are moving into a health and human services approach, because really, how are we getting good health when we're not getting connected to services well, or we are, and we need to continue to enhance that. Here in Acton, I think people are getting help. They're getting access to services. They're getting information from all of our departments. But how do we pull that together so that it's a streamlined approach to getting people access to health and services?
All right, and a little bit about Penelope.
Penelope. Okay, so I went to UMass Lowell for a community health bachelor's degree, and I went on to get a master's in community social psychology. And at the same time that I was entering my master's program, I got a position in the city of Medford to be the underage drinking prevention coordinator. So a grant coordinator for a public health cause and issue. So in many ways, it sort of centered me right into the perfect spot for my background, my program background, for my school, and really thinking about the things that were coming. It was a great trajectory for my career. So I from underage drinking prevention coordinator, I then became a regional Mystic Valley Opioid Abuse Prevention Coordinator. So looking at a much larger catchment area to look at the opioid crisis and start to figure out, like, how can we make services better? How do we address these overdoses in real time? And then how do we get people care further out in their experience? So I was really fortunate to be in that position for a couple of years. And then the city made an entire office called the Office of Prevention and Outreach. And they put me in charge of that. Mm-hmm. And that office really expanded from substance use and to mental health, to understanding issues related to, elders' mental health, thinking about how we coordinate services, streamline services, make things happen faster. And then from there, I was really dove right into the COVID, the COVID-19 crisis, and I operated more as the operations manager for the health department, which was kind of great because I had all of these relationships, all of these different initiatives already set up with many of the agencies that we needed to speak to manage the pandemic. So that's really where I kind of centered myself as the community liaison to other agencies, looking at strategic planning for how do you address these big issues like substance use, like a COVID response. But then we morphed into something even cooler, I think, because it kind of brought everything together, right? When we started talking about health equity and really figuring out how we're going to do this in a real way, not just a Band-Aid, not just what some other town was doing that sounded like a good idea. How do we serve the public in this town or the city at the time, in the best way? So I spent the last 5 years really working on building up programs there for that, and then really oddly working with climate change grants to address that issue of social resiliency. So how do we respond in a crisis? Well, we know one thing is true. If you're going to respond in a crisis, you better have systems and services set up in a very, very trustworthy, very streamlined way so that people can rely on that when something does happen that's challenging, so that they don't find their own networks that can then get unwieldy, we look to figure out ways to work with our community, understand how they operate in terms of getting help and access to help, and how do we improve those services. So that's the background that I'm coming from. That's what I hope I have been brought here to continue to enhance. I think that this community is really unique in how far they go to serve their public. So I'm really excited to be a part of this.
Well, first of all, fantastic background to have, to bring to Acton. Welcome to Acton.
Thank you.
And I guess my question would be, what you've described is more like public health management and advocacy and coordinating and outreach. So how does that tie into the traditional role for the health director here at the town of Acton? What are some of the things that are kind of being shifted?
Yeah.
I know because the traditional role required, inspections with restaurants and homes and all that stuff.
Yeah, so that's a great question. What we've done is we've sort of said, okay, we have all of these departments that are now coming under one large department and now are divisions of the Health and Human Services. So we made that health department a whole department called environmental health. So really just saying, this is what they focus on. They focus on inspectional services. They look at, real environmental based hazards that an individual might have in their home or in their property or whatever it is. And so we look at that as a whole program, but knowing that all of those things also need to be integrated into other components of our health, right? So like if we know that we see a lot of mold in homes enacted, well, I think that that's a really nice fit to say, okay, so nursing and inspectional services, what kind of projects can we come up with to start addressing this so that we can reduce risk around mold exposure in homes, right? So I think that we'll be able to weave through different aspects of getting people help. Or if it's a housing issue, how can our community resource coordinator help that person get connected to services, make sure that we're lowering risk for a housing issue, things like that. So and really the Council on Aging, oh man, they do so much, and they're also doing so much service coordination as well. So thinking about other things about how do you maintain a septic system when it's now just you? You're not a full home anymore. So what does that mean, and how do we start communicating that? So I think the health promotion side that I hope to bring in the next, as I'm getting myself acclimated, I hope that all sort of ties together. We have audiences in certain spaces like the Council on Aging, and then we have needs that we will identify. But the other thing to note is that even where the town of Acton really has been solely focused in their public health on, I don't want to say solely focused because that's not accurate. They've done many programs. They've worked with nursing. They've worked with other departments to implement a ton of different programs that are human service based or are health promotion based. So I don't want to say that, but the traditional public health department in Acton is shifting to be a much more comprehensive approach, and the state is providing that department with access to services, resources that other departments should also have access to. So I'm here to kind of broker that, make sure that we're really building a long-term plan that is helpful, but also knowing that we got to keep up on our plan because populations turn, times change. So.
Yeah. First of all, like I mentioned to you before, I'm excited that this conversation around public health and human services is getting, amplified with your presence because it's a passion area for me. And so I'm excited to see how it evolves and the different ways that we can, as ActonTV, as me as a producer, can continue, can create awareness about the services that you have, and also awareness about public health issues. So it's exciting, as you can tell. But back to your work. So what have been some of the trends you have witnessed as the new director of Health and Human Services, you said?
Yeah.
Right, I got it. Yeah, so what have been some of the trends that you've captured and that you're going to translate into certain actionable items?
Well, so I think one of the key things that I've noticed is, what is health equity and what does it mean? What's the difference between diversity, equity, inclusion, that office, and then how does public health understand health equity and accessing services, accessing health care? So I think that right out the gate, I think that this is something that we needed to make sure that we all are on the same page. So we did host a presentation from Marianne Broxton, who works for ATD Fourth World, which is an international anti-poverty agency that has done research throughout the entire globe to figure out what are some major key factors to understand people living in economic conditions that they are not able to meet their own needs, or they're not able to move out of those spaces. How do we serve those people without this paternalistic assumptions about how individuals should live their lives, right? So we've brought in a presenter to start talking about that. Like we can't truly serve people unless we're really listening and understanding them, and not just assuming they need to get on this track or that track. How do their lives play out in this town, and how do we help to enhance their lives? So that's one thing that I've definitely noticed. We need to really dig in and have more conversations about who has access to information about health. So what's our translating capacities in this community? How do we get people to trust the information that is translated? Sometimes we might need to find champions and people to get involved and to help to broker those next steps for individuals.
Right.
There's and just in general, like communications about health and accessing health related concerns. The other thing though that I really want to make sure that we're all clear on is that if you're looking at a prevention model, right? The first tier of prevention, universal prevention, is for everyone. It's health, happiness, wellness, right? It's social interactions, it's connections to each other, connections to the land. So what are we already doing, and how do we put a focus on all the good work that's happening and show people that that is a part of your mental health? That's what's going to also help you feel better every day, is to have these sort of places where everybody gets access to these well spaces. But then when we go into those places where people are starting to have emerging issues, what are our early intervention measures here? How can we improve those? How can we understand the need for those? But really, again, making sure that we're hearing from our community and not making assumptions based on the field of public health, based on existing opinions and attitudes, based on sometimes even the way we understand the community that we live in. Because maybe we don't know everybody that lives in this community, and maybe our expansion of understanding the whole community will grow together. So,
yeah, so a couple questions that came to mind as you were speaking. One, you talked about wanting to represent or to get information to groups of people who have not been getting information first by finding out who they are. And that is, I think, one area that the town has struggled with because when there are surveys, when there are events, it is the same group of people who come and participate in these things over and over again. So my first question will be, what are you going to do differently?
Yeah.
And then two, the other, when we look at our town of Acton, yes, we have a community that is underserved, but then we also have a larger community that is wealthy.
Exactly.
But they have different needs.
Right.
And oftentimes they feel that they are being left out because the focus is on the people who do not have.
Yeah.
And that creates some kind of anger or resentment.
Yeah.
And so what are some of the services that are available in your department for that category of people who are not lacking in money, but may be lacking in other ways?
Yeah. So I think that specifically for the 60 and older crowd, the Council on Aging is absolutely incredible. I could not be more I feel lucky that I get to hang out with them. They do such a wide variety of programming, and they really do that. They meet both needs, right? They're meeting the needs of the individuals who are coming to the center, but on the same hand, those folks who are not able even to get into the center but need help, they're also helping them. So they're doing that dual purpose piece. But how else can we take that show on the road? Because the reality is that people sometimes don't want to come to your location. They want to go where they feel comfortable and most trusted for them. So how do we take that lens of services to other areas of the town, and without draining what's already happening at the Council on Aging? So thinking about that. I think that as we listen to the needs and the issues in the community, we do need to hear from individuals who aren't unable to get to a healthcare provider, who don't have financial restrictions for whatever it might be, transportation, housing, whatever it might be. But what is it? What is it about the area? Is it an environmental thing we need to look at? Is it an access to social companionship? Is it something related to that? Or is it that there's not enough healthcare providers in the area? I'm not sure yet. We need to do some mapping about what are the access to services in the area to understand, number one, what's here. Number two, what are the needs? And so that will be a whole project. So there's this, a need to develop an outreach plan, as you said, to people who don't engage. So what is that going to look like? How are we going to try things differently? Who's going to show up to those spaces where people are gathering, but they're not necessarily engaging with government? Because I think that's the issue here. If I were to come here on a Saturday, which I did recently, and I was very excited to be here. I went to the Oktoberfest. That was fun. I actually came back him for the veterans, the new veteran who got that home, which was an incredible moment. But just kind of looking around, where are people hanging out? What are they doing? Are they using the shops? Are they, gathering in this space or that space? There could be a lot more information out there that we just don't simply know, and aren't necessarily the modes of transportation to get information out in the past. So I look at the whole public, regardless. I really do believe this. I don't care how much money you have. I just care about who you are and what you need, right? And so that can be anything for anyone. And then I have to look at, if you as an individual need this, who other individuals need this, and then it becomes a public health issue, right? So I still want to take care of individuals who need to get access to whatever they need access to, whether it's fun or it's help. And then I also need to say, okay, so this is translating to something so much more systematic, and I have to address that systematic issue. I am very focused on systematic issues and looking to solve those issues with partners, recruiting other people into that campaign, whatever it might be.
Yeah. And then I guess, which takes me to the next question, what are some of the programs and activities you have up your sleeve for the community to engage with?
So, as of right now, so one of the things that I want to say is that public health, for all it's worth, it is kind of in everything, right? It's in your business, it's in your home, it's in your body in a way, depending on what we're talking about. And so, but the problem is they don't fund public health to serve all the needs that public health is a part of, right? So what I really want to do is continue to look at this whole local government, whether it be the schools and or just the town, and say, what are the offerings out there? And then sometimes it's not necessarily creating something new, it's just streamlining people's view of how to get access to that. So one of the activities that I did, what I'm ultimately saying is I don't have an exact answer to that question, but it leads me to say this, is that this summer we had an intern, incredible UMass little intern. I'm gonna give her a little thumbs up if she sees this. And what she did was she went to different departments that offer programming. So library, council on aging, Ian, our conservation specialist, it's a community ed at the schools. And we said, what do you offer? And what aspect of health is this helping in this community? So it could be, so we looked at it. We want to know how many mental health based activities, whether they're for universal health or for targeted folks that are struggling and need support, what exists? Well, what we find out is, there's fewer than we expected. But what I would like to see is if I'm coming to the library, or I'm coming to the Council on Aging, or I'm coming to the town or to the schools, you should be able to hit one click and go, oh, this is all the opportunities in town to either get targeted support because I need support for my mental health, or other ways that I can learn about my mental health. There are other ways that I can, engage with others who want to learn about their mental health, right? So how do we do that? Because at the end of the day, we're in a weird space where we have a lot of virtual life. And so communications really is going to be the heavy hand to make sure that we are all communicating and all working together, because it's not going to be a barn raising down the street anymore, right? It's going to be an online Dungeons and Dragons group where someone says, hey, you might want to get that cough looked at. I'm kidding. But my point is that we commune very differently than we did 50 years ago, 20 years ago, sometimes 10 years ago. Mm-hmm. So we have to be thinking forward into the future and think about how to reach people in a real way. So, and right. I think it's dual. Both find places where people are and say hi and make eye contact, and then also streamline communication. So
you mentioned that the soul of my existence, which is communication. Yes. So I have two questions with that. And you mentioned mental health. The first question is, mental health also cuts across other departments like the police department or public safety, and they deal with mental health issues that are probably more complex.
Yes.
So in what ways do you envision your office, if there already isn't, to work together with the public safety on, say, mental health, which you've talked about a lot? Mm-hmm. And then the second one was, let's start there.
Start there. Okay, so this is actually one of the places where I feel most comfortable working in, is the conversion between public health and public safety. With my career in my previous space, we implemented a meeting called the Hub Meeting, which was a weekly 5 minutes, no cases, or an hour and a half, because there are multiple cases, of people who are experiencing some level of crisis. And specifically, if the police is involved, that's a level of crisis that we want to talk about. But they might have a multi-service approach that is needed, right? They might have a mental health issue, but they might have a housing issue, right? So what exacerbates mental health issues for people with chronic mental health issues? Other social determinants of health, other relationship issues, right? Not knowing how to get to the resource they need, not having the capacity to organize themselves to get to the resource that they need. So what we built was this hub meeting where professionals, experts in their field, people who are addressing issues, whether it be an elder service, Department of Mental Health, Department of Children and Family Services, Elliott Mental Health served that area as well. They had 5 different divisions that were coming to this meeting. And it's really a collegial space where we create these connectivity and working together. And then, but there's this moment, right, where you have crisis and then you have case management. So we need to make sure that when we reduce crisis, that we are moving people into a case management space. So it's yet to be determined. I haven't gotten far enough in with the police department to figure out how they're currently doing that work enough to say, I know what's next. I don't know what's next, but I do know that we have some will to set up this hub meeting so that we can start really drawing in our local agency. At the end of the day, local agencies, medical facilities, all these places, they need to be working together. They are the public health system. Mm-hmm. We are here monitoring, making sure that those things are happening. And it has to happen. So it is my goal to build relationships and to help people build relationships across agencies so that when agencies are working, they understand we're all working for the same thing, and that's the people of Acton.
Right, which takes me to the second question that is communication related, which kind of digs into some of what you've said, trying to connect all these different departments and stakeholders. So it's very common, not just with the town of Acton, but with any government or if any organization that has multiple departments to almost communicate independently. Yeah. And that sometimes sends conflicting messaging to the community, because if it's the same person you're targeting and you have, you know, different messaging and different information, it can become a problem,
Yeah.
a barrier to communication.
Oh, for sure.
Communication is the ability to actually make sure that the message has been
Yes.
received, delivered, and acted on. But so, what are some of what's your vision to make sure that this is either reduced
Yeah.
or that you kind of synchronize the communication
Yeah.
in public? And you know, you mentioned public health is broad.
Yeah.
So, and the things that you've highlighted are so many, they're so broad.
Yeah.
So what is that vision that you have?
So I think that we're not going to get out of this situation with a one style approach. So I think it has to be both and. So each department should have their own way of doing things. There should not be this sort of top down 100%, you have to do it this way, right? What there should be is, we're all going to do this, but also make sure that you're doing that, right? Like there should be a both and approach, multiple methods of communication, right? We have static communication that we need to figure out. What are signage in this community that we think are important and need to be up so people can see it as they're passively driving on a road within the corridors of the town? What are virtual ways that people get messages? Do people still like print? So, but how do you do that so that it's simple for the person who's trying to get the message out, right? Because I think that that's usually what the issue is you go and you're like, geez, I need to get this message out about Triple E. What are the methods that we're going to get it out, right? We had to do that. And for this particular case, it was so critical, we used a 911 reverse system. So we used that phone messaging system because that was a critical moment. We don't want to overuse that though, right? Because that's really, but guess what? It's only viable to the people who have signed on to the 911 emergency system. So in many ways, if we're going to get more communication out, we need to recruit people into that communication. So we need to advertise it. We need to think about how people are getting even the knowledge of something. And we also have to remember that they say in social marketing, which is part of public health, right? But it's really the concept of marketing. It can take 7 times before someone sees something, before their attention is drawn to it, right? We all have inattentional blindness. That's a part of human experience. We can't hold all the information that comes at us. So we only select things that are viable in the moment. So, but if you have 6 and 7 different times that you've been able to sort of circle that information to someone, by about the 7th time, they say that it does work. And then on the same thing, if you're really outreaching to someone who needs to have some changes or to take the acceptance, they have to make a change, right? It can take up to 13 to 20 times. So we can't give up, is my point. Oh, it didn't work, we can't do it that way. Well, hold on. How long did we vet that? What is our knowledge of why that didn't work, right? Before we throw out that one method or that approach. Sometimes we just gotta work it a little bit longer, see if it actually is viable, and then a one and done kind of thing. So that's what my answer is. It's both and. It's multiple approaches. It's multi-pronged, right? Things shouldn't just be sort of stand like we want to show people all of it, and we want to be able to have them be able to go to just that one thing.
Yeah.
So how do you do that? I mean, again, I think we'll have to be thinking about website changes, all kinds of big stuff that I'm not sure that everyone's on board with yet, but we'll get there.
Right. So one other question is about the town of Acton has some of its strengths. What are some of those strengths that you're looking at capitalizing on to make the work of your office more effective in our community? Well,
I mean, the most striking thing is just the idea of community here, right? The level of involvement of residents is just astounding. And I think that is a huge asset. And to me, it's like, maybe it's the spaces I'm in, because I'm in all the healthy help places for health, right? All of these folks that I'm hearing from and talking to, they care about their community members, and they want to see everybody kind of be able to have have the same Acton experience as the next person. So I think that's a huge asset. I think the people here are a huge asset. I think that the way that resources have been structured are a huge asset. I think it's a matter of, again, like weaving things together and making things clear, but I think they're all there. I think that a lot of people do have this information, right? There's a lot of ways in which people are getting that information, but who is not? And that's where I need to continue to focus on that as well, right? Making sure that we don't lose anyone who's already deeply invested, deeply engaged, continue to enhance their experience while drawing in newer and different people too.
Right. And then finally, is there anything that we haven't talked about your work as the director that you'd like to tell our viewers?
Yeah, I mean, I just think that I want to say to folks, you know, how do you help a friend or a family member, right? It doesn't have to be that you want to go and do a program at the Council on Aging. You don't have to be a veteran, but you might know someone who loves, you might be someone who loves someone that is eligible for these services or whatever. And it's really important that we speak up to each other and we help each other out, right? There are all kinds of different ways that even a brief consultation with our veterans officer can help an individual. It can help the widow, a spouse possibly. It can help the individual who's a veteran. Same thing with the Council on Aging. There's so many different aspects that you can be involved in. It doesn't just have to be meals or it doesn't have to be events. It can be a single class, you know, that it might be interesting. A Scrabble group that you might want to just come and, you know, have some fun with that. But I think that the other thing is that services will not grow in the direction if we're not hearing from you that would make it viable for you. So my urge to you is, you know, if you're 58 years old, and you're like, there's no way I'm going to the Council on Aging. Tell us why. What would drive you there? What would get you there in 2, 5, 10 years, you know? Do we need to have a, you know, Led Zeppelin cover band that people can, you know, participate? Either they're in the band or they want to come and do a listening session. I don't know. Let's continue to evolve these services because the community services are for you. We're supposed to be here to make sure that you have access to these really wonderful opportunities. They need to be tailored to who's coming though too. So we want to hear from people. We want to hear back from people, and we really just want to be creative and innovative, and be on top of the trajectory of public health. Yeah. And it's comprehensive. It's more than just your septic system.
Absolutely.
But if you overload your septic system, you're going to put nitrogen in the ground that's going to get into your drinking water. So please don't do that.
With that, I know we could go on and on, but you know, for the purpose of this particular interview and time, I just want us to end it there. But I want to say thank you for making the time to come to the studio to tell us about your role and the evolution of the health department. Yeah. I think it's important for us to understand that and where possible support your work.
That's great. Thank you so much. So, really appreciate it.
No, I appreciate it too.
You.
And to our viewers, you can reach out to her, just to the health director. Visit actonma.gov. Again, visit the website actonma.gov and you'll find the staff directory there. But for now, thank you for watching. Till next time.